Hi there, this is Coda Ramos. Got my badge right here. And today I'm going to be doing tracheostomy care and suction care. I have Rachel with me. She's going to be recording. Show yourself. Rachel's a nursing student. We're in the same class. She's going to be moving things around, like when I do my O2 and my suctioning, and I'll have this come like around here when I'm doing the intercannula stuff. So, with that being said, I'm going to go ahead and start. So I have all my PPE on, but I'm going to go through the process as well. So I'm going to come into my room, and I have about 5 minutes just to gather all my stuff. I have all of my supplies. I have my gloves, my sterile gloves, a couple pairs of clean gloves, and then I have my towel back here. I have my towel, my O2 monitor, swab, and my stethoscope. Got my trach care, suction, and my insulin. And then I've got all that stuff, and I have my PPE. So when I first come in, I'm just make sure I have the order correct. So I got on here, the order says suction tracheostomy as needed, and then routine trach care per unit protocol. So that's what I'm going to be doing today. I verified the order, verified the hospital policy, and I'm going to do my 2 identifiers. So I'm going to come over here. It's on this side. So I'm going to come over here, and I'm going to do my identifiers. So I have Jaguar J. Jones, MR number 4176352, 4176352. Perfect. Got my 2 identifiers, and it says allergic, ASA, aspirin on the armband as well. So I identified my orders, I did my 2 identifiers, and I did the allergies. So I'm going to move over back here, and what I would do is I would provide some privacy and move my trash can. So I'm going to move my trash can to a good space, which is right around here, and perform hand hygiene, and then provide my privacy. So I'm going to come over here, just close this up a little bit. Privacy, and then we're going to go ahead and start. So I would don my PPE, and the order that I would don my PPE in is my gown first, then my mask and my goggles, and then my clean gloves. So that would be the order, but I already have them on just for time's sake. And what I'm going to do now is I would lower any side rails, turn a little bit. So I'm going to lower any side rails, or I'm going to raise the bed to a working height. Oh, hold on. This is missing a wheel. And then raise the head of the bed. It's not a little too high. To about 45 degrees. He's a little high. Lower him down a little bit. Just a little short. I'm going to lower any side rails. So I'm going to lower this side rail right here because I am going to be working right here. So I lowered my side rails, made him comfortable, and now what I'm going to do is I'm going to auscultate any breath sounds. So I'm going to be auscultating his breath sounds, and I'm going to be listening for if there's a need for suction, and for signs and symptoms of hypoxia and hypercapnia. So I grab my stethoscope right here, and what I'm going to do, got stuck. What I'm going to do is I'm going to auscultate. So I'm going to take this down a little, and I will just hit these 4 spots. Can you come over here? Hit these spots right here, here, down here, and over here. Alright, so with those breath sounds, what I was listening for, like I said, was a need for suctioning. So if there's a need for suctioning, I would hear gurgling, he would be coughing, and he wouldn't be clearing his airway. Gurgling, coughing, adventitious lung sounds, and I'm missing one. Oh, and drooling. Drooling. If he's drooling, it means there's a lot of things coming up through his airways. And then when I'm listening for hypoxia and hypercapnia, I would be looking and assessing him, and I would see if he's losing any consciousness. I would be assessing his vital signs, seeing if there was an increase in blood pressure or pulse, and I would see also if he had any sign of pallor or if it's extreme cyanosis. So now that I did that and I assessed and auscultated, what I'm going to do is I'm going to grab my O2 sat monitor and I'm going to put it on his finger right here. Oop, I accidentally turned it on. It's going to go right here. Stay on there. How do I turn it off? Whatever. And then I'm also going to put a towel across his chest just to keep any secretions getting on him or anything like that. So I'm going to open it up and to protect him from any nastiness. So I'm going to put it on right under here. Okay, so now he's got everything on. He's got his O2 and his towel. So I'm going to grab my suction tube, put it right here. Sir, suction tube and my oxygen. I'm also going to put it right here. Oh, sorry. So what I'm going to do is show you up here what I would do with the oxygen and the suction. So with the oxygen, you're going to turn it up all the way to 100. So you're going to go all the way till the bar hits the top, or the ball hits the top. But we're not going to keep that on because it's a little loud. And then we're also going to do regular suction, and we're going to do between 100 and 150 millimeters of mercury. So it's getting a little high, so I would do it kind of trying to stay at like 120, if you can see that. Can you see it? Can you bring closer, Rachel? Yeah. So there's that. We're not going to keep this on either, but that's what it would be set to, and it would be set and rolling the whole time. So now that I have all of that set, I'm going to, I auscultated, and I did all that. I think I'm just going to begin. So I'm going to take off my clean gloves, glove to glove, skin to skin, throw them in the garbage, perform hand hygiene, and I'm going to open up my, my suction kit. So with my suction kit, I have it right here. I'm going to open it away from me. So I'm going to open it away. I'm going to tear the whole thing off. And I have it over here. Put it right there. I have it off. And then I'm going to perform hand hygiene again just to be safe and put on my sterile gloves. Yeah. So, put this away. I'm going to put this in the basin because Rachel's got to grab the sterile gloves again for later because I didn't bring an extra pair, sorry. Open these up. Being aware of my 1 inches. I'm going to try and go over here. Yeah. So I'm going to put my sterile gloves on. Keeping my thumb away. Oh my God. Alright, so I've got my sterile gloves on. Now what I'm going to do is take out my saline water, being aware of my 1 inch margin. Open it, make sure it's not expired. It says expire 2022, 10/27. So I'm going to take this out, pop this over here, and I'm also going to take out my tubing and replace it. So, got my saline water and I have my tubing. So with my tubing, I have a dominant hand and a non-dominant hand. My hands are sterile. Make sure to keep it away from my body. So I'm going to go ahead and wrap this up being aware of this right here. We're not going to make sure we don't touch any of this hand to this. So I'm going to take my suction tube right here, and I'm just going to pop it in. Just like that. So it's nice and stuck. So it would be suctioning right now, and we would test. So I would unwrap it. I would unwrap it, and this hole right here, this is the suctioning. So I put it in the saline water, press it, it would suck up, let go, it wouldn't. So this is just testing the suction, and it works. So suctioning is good. So I'm gonna roll it back up. Roll it back up, and we're gonna start with our patient. So he's got his O2 therapy on. So when I'm just gonna go do the suctioning, and I'm gonna be aware of his vital signs and of his O2 sat. So if his O2 sat deviates from the baseline 5%, I would stop immediately. And also if his pulse rate deviates 20 up or 20 down beats per minute, I would stop immediately as well. So I'm being aware of that. And then while I'm doing my suctioning, I'm gonna make sure that he's comfortable, and then I'm gonna have him cough while I can, or encourage coughing, just because it'll loosen everything up. But we're gonna go ahead and get started. So I'm going to take off the O2 therapy, put it to the side. We're gonna oxygenate, and we're gonna use this one right here. So what I'm gonna do is pop this on, and I'm gonna do 30 seconds, 5 to 6 breaths per second per 30 seconds. So 1, 2, 3, 4, 5, 6. All right, so he's hyperoxygenated. So now what I'm gonna do is I'm gonna take this, unravel it. You wanna go to the other side, Rachel?
Yes.
And I'm going to insert the tubing in the inner cannula. And when I'm doing that, I'm gonna make sure I'm not touching the inner cannula with my fingers at all. So I'm gonna go in, and I'm gonna go in until I meet resistance. Thumb away from the hole. Okay, so there's a little bit of resistance. So what I'm gonna do is pull back a centimeter, and I'm gonna start suctioning. And I'm gonna start suctioning in like a circular manner. Got that thumb. We're gonna pull back all the way out. All right, so now this is dirty and kind of gross. So we're gonna go to our saline water. We're just gonna suction again. And then I'm gonna wrap it up. And then hyperoxygenate again. And when you're normally doing this, you would give them, you would wait a minute between passes. So I would have waited a minute, and then I would hyperoxygenate again. All right, it was a little sped up, but we're recording, so. Also, between passes, what you're also gonna make sure that you're replacing your O2 therapy, like between passes as well. So I'm gonna do my second pass. So I'm going to unroll again, go in the inner cannula. I have my resistance right here, pull it out a little bit, and then you're going to suction. All right. So I did my second pass. I'm gonna roll this up in my fingers, and we're done with our suctioning. So I can kind of do this, hold it, and then we're gonna hyperoxygenate again. So we'll do another, again, 5 to 6 breaths, 30 seconds. 1, 2, 3, 4, 5, or 6. And then we're gonna replace, make sure that that stays on, because otherwise they'll die. So hyperoxygenated, we're done. That guy's O2 therapy on. So what we're gonna do now is we're gonna take this off, pop this off, put this right there, and just go ahead and throw this away. So I threw away that, and we're done with the suctioning. So now we're done with the suctioning, I can go ahead and take off my sterile gloves, glove to glove, skin to skin, and I would normally throw it away, but right now I'm gonna have Rachel refold them for me. So I took off my sterile gloves and I performed hand hygiene, and I'm gonna put on another pair of clean gloves. So with my clean gloves, what I'm gonna do now is I'm going to auscultate again, and when I'm auscultating, I want to be looking for clear breath sounds. Before I took off my sterile gloves, this is a whole correction, I need to go back. Before I took off my sterile gloves, I would take off the towel because it's got all the secretions on it, and I would get rid of it, and I would then take off my sterile gloves, perform hand hygiene, and put on my new gloves. So towel would come off before I take off my sterile gloves, right after I'm done with my hyperoxygenation. So now what I'm going to do, now I'm going to auscultate again for those clear breath sounds. Alright, so his breath sounds, if the suction did work, his breath sounds should be clear and even bilaterally per auscultation. So I'm put that there. And now what I'm going to do after I auscultated is I'm going to open up my tracheostomy care kit. So I can stay. So with my tracheostomy care kit, same thing. I'm using aseptic technique. So I'm just going to keep these on. So I'm going to open this up. Whoa. Open this up, take this all the way off. Throw this away. I feel like I'm missing something. Wait, hold on. I think I'm fine, actually. Yeah, I think I'm fine. So, I don't know what these. So, I think I'm forgetting something. Whatever, I think I'm fine. So, what I would have done is I would have my clean gloves on, and I would open my tracheostomy care kit, and once I have this, I would take off my clean gloves, perform hand hygiene, and put on my sterile gloves. Put this away. No, I messed that up completely. I need to take out the inner cannula and everything. Oh my god. So we're restarting this skill. So ignore all of that. Can you stop it? Because this is a second skill technically, so I can do another video.